Hello everyone, welcome to 5 Shu Points 7, presented by Lamp AccuWellness Foundation Inc. Ying-Spring points. The spring points are generally found around the distal metacarpal and metatarsal joints. In these areas, flesh begins to accumulate and the development of channel qi undergoes a change. There is increased circulation of qi and blood. Channel qi is said to be moving at a faster rate at the spring points, although its nature is still dripping and the flow is not yet strong. Nevertheless, the inner classic describes the qi here as flowing and conveys the idea that channel qi begins to move at these points. Specifically, this is the first movement inward. While channel qi emerges at the well points, it begins to move in a particular direction at the spring points. The classical text suggests that the heat-clearing function of the spring points should be narrowed to mostly those cases where heat is caused by a deficiency of yin and/or blood. Because of the slow initial movement of channel qi at the spring points, stimulation in this area has an effect of generating yin fluids. The next transport point up the line, the stream point, integrates the more yang-natured source qi into the process. In the clinic, the pathodynamic of the spring points often involves patients with low-grade fevers. For example, in the fairly common case of lung yin heat from deficiency causing sore throat, lung 10 qi can be quite effective. Heat caused by yin blood deficiency is also often present in cases of pelvic inflammatory disease. In these cases, the spring points of the spleen, liver, and kidney channels, spleen 2, liver 2, and kidney 2 may be appropriate. Liver 2, Xingjian, is commonly listed in modern texts for clearing liver fire. In fact, while the point does have the ability to help clear excess-type liver patterns, it is most appropriate when liver blood deficiency is also part of the pattern. In cases of true liver fire excess, it is often more effective to choose points on the paired Shaoyang channel to clear heat upward and outward. The spring points are also used for many patterns that involve chronic inflammation with an element of deficiency. Acute inflammation, on the other hand, is usually better treated by bleeding the well points. For example, when using lung 10 for throat inflammation, the inflammation should be of a relatively chronic and deficient nature. If a patient presents with acute tonsillitis, the well point, lung 11, Saosang, is much more likely to be effective. Similar principles hold true for most of the other channels. An obvious exception to the deficiency heat theme is stomach 44, Nei Ting. This point is in fact very useful for clearing excess type Yangming heat. There are always exceptions. Ying-Spring points are the points at which the qi glides. The Ying-Spring points, Ying means spring, are all located on the hands or feet and are the second or penultimate points of their respective channel. According to the classical sources, the Ying-Spring points are indicated for heat in the body, changes in the color, complexion, diseases of the yang channels, diseases of the zhang with a Shu-stream point. The Ying-Spring points, without exception, have an important effect on clearing heat from their respective zangfu or channel, especially like the Qingwell points from the uppermost portion of the channel. Among the 5 Shu points, they reflect the closest correspondence of classical Shu point theory, 5-phase theory, and clinical practice. The Ying-Spring points of the yin channels belong to fire, and those of the yang channels to water, and both may be reduced to clear heat and fire from the body. Among the most important of the Ying-Spring points with this effect are the following. Yu-Ju, Lung 10, clears heat from the throat, the upper extremity of the lung channel. Clears dry heat from the lung zang in cases of coughing, especially when accompanied by bleeding and chest pain, and clears heat transmitted from the lung to the stomach in the middle jiao and the heart in the upper jiao. R. Chen, Li2, and Nei Ting, stomach 44, treat heat disorders affecting the upper portion of the channel in the face and head, whilst Nei Ting, stomach 44, also clears heat and damp heat from the intestines. Dadu, spleen 2, clears heat and damp heat from the spleen, stomach, and intestines, giving rise to diarrhea, constipation, vomiting, and epigastric pain. Sao Fu, heart 8, treats heart fire, which transmits first to the small intestine and thence to the bladder. Rangu, kidney 2, is the strongest point on the kidney channel to clear deficiency heat from the kidneys, which either rises to the upper jiao and manifests as throat painful obstruction, coughing of blood, and wasting and thirsting disorder, or blazes in the lower jiao, giving rise to genital itching, uterine prolapse, infertility, irregular menstruation, difficult urination. Lao Kung, pericardium 8, is a powerful point to clear heat from the yin and blood levels and from the pericardium during febrile diseases to cool heart fire in the upper jiao, for which purpose it is more strongly indicated than Sao Fu, heart 8, and to drain stomach heat. Sha Si, gallbladder 43, clears heat and stagnant heat, heat deriving from qi stagnation, from the head, ears, eyes, face, breast, and lateral costal region, indeed the whole of the gallbladder channel. Xingtian, liver 2, is the principal acupuncture point to clear liver fire affecting any part of the body, whether blazing upwards to the head and eyes, disturbing the heart and spirit, transversely invading the lungs or stomach, entering the blood and causing reckless bleeding, or disturbing the lower jiao. As far as changes in the complexion are concerned, this theory may be explained by Liao Runhong's statement, Ying-Spring points are for heat of the body, heart pathogen, since it is the heart which manifests in the complexion. However, the use of the Ying-Spring points in this way has little application in clinical practice. As far as acting on the yang channels is concerned, the Ying-Spring points of all the 12 channels, both yin and yang, have a strong action on clearing excess pathogenic factors, stagnation and heat from their respective channels, particularly like the Qingwell points from the uppermost regions of the channel, In comparison with the Jing well points, however, they have a relatively greater action on disorders along the whole course of the channel, rather than just its upper end. R10 Li2, for example, in addition to its ability to treat disorders in the head and face, is also indicated for pain and stiffness of the shoulder and back, and cold and pain in the region of the point Jianyu, Li15. Similarly, Tian Ku, Si2, in addition to treating such disorders as mumps, swelling and pain of the neck and cheek, throat, painful obstruction, also treats stiffness and pain of the neck and back, and pain of the scapula, arm, and wrist. Combination of Ying-Spring and Shu-stream points. Pain of the lung and heart, Taiyuan, lung 9, and Yutzi, lung 10. Somnolence, R10, Li2, and San-10, Li3. Deafness, Tian Ku, Si2, Hausi, Si3, and Pian Li, Li6. Swelling of the inside of the throat, Rang Gu, kidney 2, and Tai Si, kidney 3. Ceaseless laughter, Ta Ling, pericardium 7, and Lao Kung, pericardium 8. Oppression of the heart, Ta Ling, pericardium 7, and Lao Kung, pericardium 8. Pain of liver and heart, Xing Chen, liver 2, plus Tai Tsung, liver 3. When needling, keep the nature of channel qi at the spring points in mind. The movement here is said to flow in a very thin, broken line, in contrast to the dripping nature of channel qi at the well points. Consequently, qi sensation for the patient should also involve a light and gentle movement down the channel. By facilitating the natural tendency of the point, the production of yin blood in the channel can begin. Specifically, needle insertion should be shallow, and the stimulus should be a gentle twirling technique. The result of spring point stimulation is not a large burst of yin blood, but gradual growth. Thank you very much for your attention, and see you on our next videos.